For years of staff. 71%.
All right, well, let's call our meeting to order. We're going to begin tonight with our pledge. Do you join me? To the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. A moment of silence, please. Thank you very much. We are operating under Executive Order 63, which you would have seen posted when you come into this building, and so we're asking for everyone to do their part that we might abide by Executive Order 63. Appreciate what everybody's doing. Keep us in a good stance there. We welcome you to our monthly meeting. We are here to accomplish the business of school for the sake of our students. We do want to hear from our citizens, and there's time for public comment prior to action items on the agenda. We ask speakers identify themselves and their home district. We also ask that your comments are limited to 3 minutes in order to provide equity to all speakers and to ensure our meeting is reasonable in length. If you have more information that can be summarized in 3 minutes, please provide leave-behind materials for the board's review. The moderator will ask you conclude your remarks as the time is elapsed. If you have questions during the session, you may ask for clarification from your school board member or the school administrator after the meeting is adjourned. Thank you for coming. Is there a motion to adopt tonight's agenda?
So moved.
We have a motion, Ms. Bond, second.
Second.
Second, Mr. Grove. Any comment? All in favor, aye? Aye. Opposed, no. So ordered. Is our board liaison available this evening?
Yes, she is.
She's remote.
Yes, she is. I looked at her.
Neat.
From Iowa.
We have a still frame.
Hi, school board.
Hi.
I'm still the school board representative. You guys haven't seen me for a while, so I'm just going to read off the list of current events happening real quick. FFA started up and elected officer positions. The Wonderful Wednesday camp is still going well. Rappahannock has opened up a study hall on Saturday for students who need the internet. And there have only been 66 total coronavirus cases and only 4 in the last 2 weeks, none of which have been from our school. Have a good meeting.
It's so great to stay connected. Okay. We need to say thanks to her. Is anybody, can you just tell her thanks?
Thank you.
Can she hear us right now?
That was video.
That was video?
This is asynchronous.
This is learning vocabulary. Hey, Mr. Smith.
Great. Donations.
Yes, I have some to report. I have 3 donations that donated to the gift bags that were given to the U.S. Department of Education guests. Turner Foods donated jelly and chutney samples. Beach Spring Gift Shop donated 24 jars of apple butter. The Inn at Little Washington donated 15 cookbooks and 15 jams. Then I have 2 other donations. The Williams Tree Service donated 100 small pumpkins for campers to decorate. And the Woodmen of the World Chapter number 203 donated $500 for COVID-19 needs and other Title I needs.
Great. And you know, those gifts were really, they were impressive because they went out to the dignitaries that were here visiting our school.
Yeah.
And so they went home with quite a bag of goodies.
Very nice.
And it represented our community really well.
Mm-hmm.
So really appreciate all those gifts. Is there a motion to adopt the minutes from September 8th?
So moved.
We have a motion from Ms. Biden. Is there a second? Second from Mr. Grove. Is there any comments? All in favor, aye? Aye. Opposed, no? And so ordered. Mr. Grove, did you have opportunity to review the bills?
Actually, I did, I saw the bills that I signed tonight, but they're not on my, yes they are. I am terribly sorry. I did review the bills that we signed tonight, so we're all in good shape. They're all signed, ready to go.
All right, thanks. So the consent agenda contains the approval of the donations to the warrants to pay the bills, the attendance report, and the homeschool report. Is there a motion to adopt the consent agenda?
So moved.
No motion from Ms. Meyer. Is there a second?
Second.
Second from Ms. Bynum. All in favor, aye?
Aye.
Aye. Opposed, no. This will order. Dr. Grimsley.
Thank you so much, Mr. Chairman. We're going to start this reports of the superintendent tonight with Dr. Johnson coming up to brief the board about some mental health updates that we have. And we have quite a few events, and September was Suicide Prevention Month, and October is a lot of different things month that support mental health and students with disabilities and different things. So Dr. Johnson, would you like to come to the mic? And I will pull up your presentation. Might have to test that a little bit. You really need to speak into it.
You're good.
All right, this is going to test my skills of coordination here.
Do you need help?
If you could give one of those to each of the board members. All right, and Mrs. Rogers is going to bring to you.
I don't think it's working. Oh, is this the orange thing?
Okay, William. Is that good?
Test.
Testing, 1, 2, 3.
There it is.
Testing,
Can you hear her okay back there?
testing.
No?
Okay, awesome.
Now? No?
So this, the
Do you want to sit
You
here?
know what, you can come and sit and use one of these. These mics are amazing over here.
Yeah.
Maybe this one.
Yeah.
What do you think about just sitting at Chris's? Yeah, that'd be great. Everybody over here.
All right, how's that?
Great.
Way better.
Okay, awesome. So the orange ribbons are a gift from our mental health innovators team in recognition of Unity Day. And I'm going to give you a quick overview of what's going on in Rappahannock County Public Schools as far as our social emotional programs. In preparation for talking to you this evening, I decided to do a quick inspection of social emotional learning needs as it relates to students during the pandemic. And that quick inspection was enough to make my head spin. Research is suggesting that children may develop feelings of sadness, anxiety, fear of death, fear of their parents' death, or fear of being isolated in the hospital, which may have a very detrimental effect on their psychological development. That's from the American Psychological Association as well as the CDC. There have been spikes noted in calls to suicide hotlines from young people. Findings reveal that children feel uncertain, fearful, and isolated during our current times. It was also shown children had experienced disturbed sleep, nightmares, poor appetite, agitation, inattention, separation-related anxiety, and difficulty regulating behavior. In the present pandemic era, there has been a rise in hoarding behavior amongst teenagers, which is an instinctual survival behavior. This time is especially challenging for our special needs students who already may have heightened mental health needs. Also for our students from low socioeconomic backgrounds whose families are having difficulty just finding the resources to support them physically and financially. Minority students are also at risk during this time with online teaching strategies and practices. that may not necessarily address their needs. These findings all call for increased access to mental health support services that are geared towards providing students with healthy coping mechanisms during the current crisis. So fortunately, as we like to do here in Rappahannock County, we are ahead of the curve in addressing these needs for our students. I don't think we could have been better prepared if we would have known the pandemic was coming, which we had no idea that it was coming. But the addition of our school social worker and our new behavior specialist have put us in a very good position to be able to help our students. Our new behavior specialist, Carly Moore, is a Longwood University graduate, and she's pursuing her master's of clinical mental health and counseling through Liberty University. I have the statistics that she shared with me for the activities that she's conducted during the month of September. She had 76 student meetings, 5 group meetings, 16 in-class interventions, 27 parent contacts, 10 video sessions, 51 teacher consults, and 6 de-escalation of student behavior. It's quite a bit to accomplish in the first month of school. And when you look at that in comparison to similar statistics from our school social worker, Ms. Sickler was able, between her school sessions, video chats, and phone and Facebook communications, to meet with 125 students during the month of September, which is approximately, between the two ladies, 30% of our student population that we were able to help with services in the month of September. So September is also Suicide Prevention Awareness Month, and our school social worker, Kathy Sigler, took the lead on these activities. In September, she facilitated class meetings at the high school. She discussed with students in these class meetings warning signs that might indicate someone is thinking about suicide, and helping students recognize how to be a good friend and listener, the need to be connected with a trusted adult. She also had them program hotline numbers into their phones. She's going to continue with this in October for grades 3 through 7, and then in November she'll meet with our remote students via Zoom meetings to cover this very important topic. Then last week, October, was Mental Health Awareness Week, and as you're aware, we do provide mental health services to our teachers, parents, and students who are referred. We still have an agreement with Health Connect America to provide counseling services on our school site. We currently have 4 students who are receiving counseling through their IEP. We have 4 students who are receiving school-based counseling. We have 8 students who are receiving counseling through Medicaid funding. We will also be starting a staff support group based on reports that we received within the last week or 2 that some of our staff members are having a difficult time. So we want to be able to provide those supports for our staff as well. And all of this is in addition to what our school guidance counselors and behavior specialists and social worker are doing. So you're also aware that we have a new social emotional learning curriculum this year that is being implemented at the elementary school through morning meetings and at the high school through a first block leadership seminar. So for our elementary school, they adopted the second step social emotional learning curriculum. The high school adopted what is called Habitudes. And you can see through the activities that are described for these programs how it addresses the developmental needs of our students and moves them in kindergarten through focusing on attention, empathy, emotional management, then on up into middle school. It helps them to begin to think about mindset goals, addressing bullying and harassment, which become more prominent during those ages, decision-making relationships. And then with the high school curriculum, the emphasis is more on leadership skills, taking initiative, problem solving, capitalizing on strengths, and developing those critical thinking skills. So for October, we have upcoming bullying prevention activities that are being sponsored by our OBEYS team. Those events include Unity Days next week, in which they'll be wearing orange to show that we're going to stand together for kindness, acceptance, and inclusion. And then we also have a Spirit Week for each of the schools coming up over the next 2 weeks. The elementary school will also be emphasizing Kindness Matters through their morning announcements throughout the month of October. And then on the next slide, there's a description of the RCES Kindness Count Spirit Week, which will go each day of the week showing a different form of kindness. And then the main emphasis, as you can see, is building that culture of kindness into our school culture. The school psychologists and mental health innovators team did share video clips with the teachers at the schools to share. And I don't know, Dr. Grimsley, if you can get that link to work at the bottom, but this is an example of the developmentally appropriateness of how we try to work with our students on these issues. And if you can get it to work, it's a kind of a nice way to show how we instill this in our younger students.
I'm a millennial, I can do this.
When you're older, I know you understand.
difficulty because his friends did not want to play with them. So they initiated this video, and he was so excited that, he not only got to play with his friends, but they got to help him to make the video as well. So I thought that was important to share, because for our students to be able to see things like that, you notice this was pre-COVID, there were no masks, there were no social distancing restrictions, and along with the message of playing together, showing kindness, getting along with each other, I think it just gives them that little extra spark of hope that things will get back to normal and that they'll get to be with their friends the way they were in the past in the near future.
For letting me share this evening. Our Mental Health Innovators team thanks you as well. They gave me many of the things that were on the slides this evening, and they send you their best wishes.
You have any questions?
Anybody?
Wanted to remark that I really like seeing the orange standing for kindness rather than stamping on bullies. Because I think it's important that we're not going to stamp on anybody.
Yes.
I really appreciate that change in terminology.
Yes. Our team has done a phenomenal job with that.
And we really are fortunate that we've staged this hiring plan and the things that we set as our goals. I mean, they happen. Everything happened at just the right time for us. Mm-hmm. We were in a really good stance.
Yes.
Almost like we knew what we were doing.
Well, I don't think we can take credit, but it's wonderful how it's worked out for the good of the student.
Yes.
Yeah? So,
Yes, absolutely.
Great team.
Thank you. Okay, at this time, I'm going to invite Susan Stoltzman back to give a quick update to the board of how the Wellness Center feasibility discussions are going. So we'll just continue to use Mr. Eubin's mic for now.
Oh, sure.
Would you like us to wipe it down before you speak? These ones you can stay far enough away where you're not really breathing on it.
Thank you, Amy. Can you hear me?
Yes.
So this is a perfect segue from Dr. Johnson, and please jump in, you and Dr. Grimsley.
Yes, ma'am.
We're moving forward at least with the mental health component of the Wellness Center. We've expanded our agreement with Health Connect America. Specifically, we will have a licensed mental health provider available for counseling sessions in both of the schools for 1 day a week to start, increasing as needed, which Kathy, Ms. Sickler, thinks will increase very quickly. The campuses need to be licensed so that those providers can come in. And Mindy Williamham, who's the Director of Operations at North Central VA Health Connect America, feels that'll take about 30 days. She doesn't anticipate any problem. She said the restrictions that the schools have usually stand them in really good stead for that licensing, so it's almost a paperwork thing. And then the other capability we'll have, if the need arises or as the need arises, is to be able to have telehealth visits with a psychiatric nurse practitioner for evaluation of psychotropic medications. And I don't think I made this clear last month. No child would be prescribed medications, obviously, without parental approval and on the recommendation of their therapist. But also, the medication and the therapy sessions have to go together. You don't get the medicine without the therapy session. They need to be going on simultaneously. So we will set that up as the need arises. Mindy feels that it works very smoothly. The students would get quarterly evaluations at the school. The next I wanted to talk about was Valley Health. As you guys remember, last month I talked about perhaps them acting as our the night of the school board meeting. There was a nice message from the know the specifics of the grant and how they might be able to partner or assist. So Dr. Grimsley and I had a long meeting with Ben and with the operations manager for rural health clinics. And they had not, it was a positive meeting. Valley Health has a lot of balls in the air, as you can imagine, with COVID. They got back to me, Ben got back to me today. And I won't be sad, I'm going to remain really optimistic. So he said that they just don't have the resources to donate to standing up the clinic for what we had envisioned. Shannon and I had kind of a big ask. You know, we wanted them to basically be our billing and our administrative services. They have several large projects with COVID, and everybody's running around like a chicken with their head cut off is kind of the impression I got. However, the tone of the email was really positive, and what he said is, in the interim, which makes me believe that maybe this is truly just an interim and just not a great time right now, could we be creative and innovative in using the Valley Health Clinic across the street? He suggested we could participate in transportation. I, as a provider, could work there different hours. We could coordinate with Brooke and Ms. Miller. So at this point, we're just, it's a feasibility study. So I'm just going to continue to reach out. We have some other, the School-Based Health Alliance, who's our consulting agency, has some additional ideas, and I'll be talking to them about that on Thursday. So we'll just continue to see and work towards that end. The last thing I wanted to say was that we are starting our first 2 working meetings with the School-Based Health Alliance this week and next week. Ben from Valley Health committed to attend that meeting next week, which is great. It would be wonderful to have the level of expertise that he has at a meeting like that, again, that's looking at feasibility. Plus, maybe he'll just be so impressed that he'll change his mind and be dying to get involved. But Mindy Williamson from Health Connect America will also be involved in all of the meetings. Mindy and I are going to do them all together, and hopefully we would have Valley Health or perhaps another entity attend as well. So just specifically what will be talked about in the next couple of meetings are what they call School-Based Health Clinic 101, core competencies such as sustainability and systems coordination. We'll look at virtual tours of other school-based health clinics, which will be helpful for me because of the space we had set aside in the elementary school. It'd be helpful for me to see what other folks have done. School-based health partnerships, and we're going to be completing a readiness assessment, which will help us do a business plan. And so there'll be introduction of that tool. And that's where we're at.
Thank you so much, Susan. Does anybody have any questions for Susan? She has been a very busy bee, and she keeps all those providers on their toes and is always, connecting and with the outreach and working with the consulting agency. So we're thrilled to have her on board. She's doing a fantastic job.
Thank you.
Great progress. Thank you.
Okay. Up next, we have our Commit to Be Fit team to give their annual report about how things have gone. So we can either try to fix this again, if you guys can project pretty well, so maybe it'll come out. We did have it working. If not, we'll just continue to use this. And maybe, I don't want to say, hope Mr. Ubin doesn't come.
Do you want to make this black step down? Test. Oh, test. Test.
Nope.
It was working before. There. Come up here. Try again.
Test. Test, test. Test.
Pretty good.
All right, we'll try there. Just speak very loudly.
You know, if you bring a chair, sit right there, do that.
That'll work too.
Okay, that's not a bad idea.
There you go. Just bring a chair over.
Sorry.
Go sit down here. Yeah.
All right, sorry, my bad. I was so cool. That's true.
Right, you tell me what you need me to do. Okay. So we're here to present last year, which was year 3 for Commit to Be Fit.
We're currently in year 4, which is hard to believe that we established this program and we're in our 4th year. But we're given a yearly summary of year 3, which was last school year, and it obviously ended abruptly with COVID. So Holly is going to give you the booklets, or Mandy will, if you could follow along with the booklets. But first, what I'd like you to focus your attention on is a video. Our funders, Path Foundation, they did a spotlight on Commit to Be Fit. And they came to our schools, and this was prior to COVID. We were talking today, we think it was around this time last year. It was in October, but not the actual date, we can't remember. But and they came and spotlighted our program in the Neuronasium and the ABL and the Farm to Table. So I'll stop talking so you can see the video. It's just a couple minutes long, and it's really cool.
Okay.
Shannon?
Yes, ma'am.
Thank you. Come on out, girls. There you go.
Commit to Be Fit is a program about developing healthy habits and getting children learning about nutrition and fitness and movement. We want to get kids out of their seats because when they are sitting, their brains fall asleep.
All right, we're going to go through the stations again today. The Alligator Crawl, Miss Atkins is simulating that. Lay on your belly, and you do opposite arm, opposite leg. Anytime that we can cross the midline, it makes both sides of the brain communicate. So we build that strength between the left side and the right side of the brain. These are our turtle shells, and they sit in there. It's proprioception, so they just kind of find their body in space. The kids are in a rotation that we see them weekly. And then when they go back to class, their brain's like on fire, the neurons are all lit up and they're ready to learn.
Welcome to the Neuronasium. I'm not trying to get a workout, but we're trying to get some blood flow into our brain. And the Neuronasium gives a kid a chance to talk and be active as they're thinking about how these words work. So what that means, casa is alta. Very good, the house is tall.
We can get our wiggles out while working. That way we're not having to go and redo our work because we weren't paying attention.
This is a Farm to Table class where 6th grade students get an incredible hands-on learning opportunity. They learn where food comes from, how it's grown, and the best part is enjoying it and eating in the cafeteria.
With the grant funds for the Path Foundation, Commit to Be Fit impacts 100% of our students. We are getting children learning very, very early on how important health and wellness and nutrition are, and they're becoming healthier citizens.
Wasn't that a cute video? We're so grateful to the Path Foundation for providing the video and, of course, funding this entire program. So as Jackie mentioned, we are just doing a very, very quick overview of our year 3, which that theme was changing the community culture. So school board members, I invite you to follow along with the booklet. For those that are in the audience or watching at home, this entire booklet will be available on our website starting tomorrow morning at rapc2bf.com. So I just would like just to scroll down to page 5. So page 5 really highlights some of the new things that occurred during year 3, which is school year 2019-2020. And I should point out, while there are so many cute pictures, this was from last year prior to March, so that does explain why you're not seeing any face mask and quite a few close children as well. So new to school year 1920, we introduced the sensory pathway, which you probably saw when you walked in this evening. It's a great opportunity for students to get additional movement at the elementary school. Also, we started really spotlighting some monthly wellness warriors from the Action-Based Learning Lab. We also did more classroom push-ins where we visited classrooms and provided movement opportunities, which Jackie will share with you in just a moment. In addition to our weekly community newsletter, we also started out a monthly parents newsletter, which is geared directly towards our parents. In addition, we had a greater focus really on social emotional well-being for staff and for students last year. You'll notice that the picture at the very bottom, far right, we are wearing free hug t-shirts, which seems crazy in this day and age. But at that time, we actually invited the staff to come in for a hug. And then also Mindful Minute was a new initiative that we did last year to really help the children reduce stress and to self-regulate through taking deep mindful breaths.
Holly? All right. Within the cafeteria, which is our next section, we continue to emphasis on local foods. The picture shown is from Farm to School Week last year. And last year we purchased more local foods compared to the previous year. Yeah, there we go. The far right picture was actually, we had a fruit versus vegetable March Madness tournament, and that was on Friday, March 13th, and we kind of laugh how that was our last normal picture before everything changed. Continuing on, we continue our Pop-Ups program, Power Produce, where students can use their virtual pop-ups now at the farmers market. And one change that we adapted to with COVID precautions is we have it's a pre-order sign-up for a market bag. So it's similar to a CSA style bag. So they're getting a protein, a bag of vegetables, a homemade loaf of bread, and a bag of mushrooms from local vendors. And we have found this to be a very positive change of COVID that will continue on. It's a great bang for the buck, not only for the farmer, but for the family. So that's gone really well this year. So our pandemic response, as you're familiar with, we started feeding students the Monday that we were closed. And in hindsight, this very much prepared our model for how we're now serving virtual students on their learning days while they're at home. So that has gone very well. Over the summer, we fed, March through the end of summer, over 21,000 free meals to our community. And this school year, USDA announced that all students could eat free, which has been very positive for our school system. Currently, that was through the end of December, and then we heard Friday afternoon that will be extended all school year, so through June 2021. So we are very happy, and we'll be sharing that out publicly soon.
So this brings us to the classroom prong of Commit to Be Fit, and we continued with our Action-Based Learning Lab, pre-K through 5th grade, and really our emphasis last year, year 3, was more push-ins, more mindful minutes, and integrating movement with curriculum inside the classroom. And so here you can see students are participating in those, the movements with the curriculum. They're exercising the answer, and we know the research shows how movement kind of anchors those concepts. And then we also continue with our high school. Miss Butler and I co-teach. She does the nutrition, I do the fitness part. Nothing really changed with that, with the elective. However, we did want to emphasize more community with that class, so that was Stuff the Bus. So our actual students from the class assisted us with that, just to connect them to the community. That was really important to us, and that was kind of one of our emphasis for that particular class. As far as pandemic response, our C2BF website, we posted at-home activities, and I must say, we did that pretty quickly. Mandy was saying she started serving lunches on Monday, and we started offering activities at home for our students. So those are some of the wellness activities, including that mindful minute. I wanted students to be able to have a guided mindful minute at home in case they really need to self-regulate or really needed that. So, Holly?
All right, so our third prong, community, on page 14. I just want to point out that we had a lot of the same classes that we did from previous years. In total, from August until March, we offered a total of 323 group fitness classes, workshops, as well as events. What was new to last school year is we offered 3 different classes weekly that were brand new. The first one was balance, which was an amazing class to really help promote balance. As we age, we have a tendency to lose some of the balance. So that was a wonderful class. Also, meditation and relaxation, which was in line with our social emotional mission, as well as a Goal Getters workshop series, which was brand new to last year. But you can just see some of the fun pictures that were offered. And as always, all of this was free of charge for the community. Moving on, we also focused on staff wellness. Last year, we did have staff challenges. Again, the social emotional component, we focused on kindness, really sharing kindness with others, as well as gratitude, reducing stress, and then also fitness and increasing green vegetable consumption. We also encouraged our teachers to engage in movement activities within the classroom. And if they did so on a Wednesday, they got to wear their workout clothing to work on Wednesday. So that was a nice hit, as long as they either invited us into the classroom or they led their own movement activity with the kids. So moving along to pandemic response. Like others in the community, we really wanted to do something impactful that could benefit others, our neighbors that needed assistance. And we also still wanted to be able to help the community engage in good behaviors. So we came up with the idea of doing a Step on Hunger challenge. And initially, we challenged the Rappahannock community to walk the distance from Rappahannock County to San Francisco, California, which is roughly 5.6 million steps. And for each state line that we crossed, we had a designated amount of food that we would purchase and donate to the Rappahannock Food Pantry on behalf of the community. 5.6 million steps, or 2,800 miles. That's quite a lofty goal, and we thought for sure it would take us a few months. Well, Rappahannock stepped up. In fact, we hit that goal within 12 days. So it was amazing, the response. The community really wanted to give back and to help. And all they had to do was walk and log their steps. And it was absolutely amazing. So we hit our goal on week 2, and we decided we'd walk back to Rappahannock from San Francisco, which we did by the end of week 3, which was amazing. In total, we had donated over 1,500 pounds of food to the Rappahannock Food Pantry from the community. So very cool. Again, we expected it to take a few months. It ended up just being a short 3 weeks. So we kept up the fun and the engagement. We ended up doing 2 weeks of Step for Heroes, where we had the community walk on behalf of volunteers or first responders that were helping during the pandemic. And then for the last 2 weeks, we honored our seniors, our graduating seniors. Each member of the community walked for a student and we ended up sending a card on their behalf to the student with a milkshake coupon, and every single senior received one. The event concluded with a virtual walking event for the community, which was on the night the students were supposed to have originally graduated. So in total, we, within 8 weeks, walked all the way from Rappahannock to Australia with over 11,000 miles. So it was quite impressive, and we were just blown away by the engagement in the community. It was wonderful. All right, so looking ahead, that was just a nice little wrap-up of last year. Looking ahead, we do have a few new initiatives that are coming out we're very excited about, such as the Daily 15, which we are encouraging our staff to take the students out for 15 minutes of walking per day. It's a nice opportunity to get blood flowing and to get outdoors, get fresh air, perhaps a mask break. So we have great competition running at both elementary and the high school for all grades. Also, community challenges. Last month we did a self-care challenge. This month we're doing a Hike Rappahannock challenge, so we invite everybody to participate in that. Also, greater emphasis on staff wellness as well as mindfulness for our students. And lastly, our mission really for this year is to creatively adapt to the needs of our students, our staff, as well as our community. Jackie, Mandy, anything you want to add? Good job. Thank you for your time.
Great program. Thank you, ladies. Anything else? Anybody? Any questions? Hey, so it's not only changing the culture, but it's reaching out to the community. It's been a great service to many. So we have something to be very proud of in this program. Well done.
Thank you so much, ladies. Fantastic job, and couldn't ask for a better team. They work so well together and just are so engaging with staff and students, and they just didn't get let down at all when the pandemic hit. They're like, okay, let's adapt, let's rewrite this grant, let's rewrite our objectives and see what we can do, and it was just incredible, so good job. This is the point in the meeting where we record that the new SIPA policy was read, so I'll just ask you to take a moment if you haven't already and look at that. I think I have it down here. Yes. And it is loaded on BoardDocs too for your review. So we can let the record show that the SIPA policy was read. This is our acceptable computer use policy, just has to be reviewed by the board each month. And this one is the only policy that we actually have that says please just literally read it at a meeting and record that. So we'll do that. But this is what we give out at the beginning of every year in our student handbooks and what we ask parents to review with their students. Particularly important this year with so much virtual learning going on. Okay, item 4.5 is the termination of the regional special education program. So Dr. Johnson, if you could come back to the mic and talk to us a little bit about this and what the impetus was behind this.
I feel like this is a saga that comes up every month with the regional special education tuition program. So this year, they have decided to standardize the process. When they started this 2 years ago, they were just opening it up to all of the school divisions in Virginia, so they didn't have a very streamlined process for it. So lo and behold, across through the course of the summer, they decided to redo the application process. So they also decided that we did not have to create a regional tuition program because that established Fauquier County as the fiscal agent for the funds. What they now want us to do is each county will handle their own funds. So we are asking the board this evening to dissolve the regional special education tuition program in lieu of this new MOU, which will allow us to handle our own funds. And that's the update on the saga for this month, and then we'll see what comes up next month.
financial piece. Everything else is still regional, cooperative,
Yes.
except for the finances.
That is correct.
Wow. All right.
Thank you again, Dr. Johnson, for staying up on top of all those quick updates.
It's not a termination of the program, really. It's termination of the financing of the program.
Yes, and yes.
Switched it.
And that'll be an action item later, so if you want to be specific in that verbiage when you...
You have some pre-printed verbiage to make
Yes.
sure we don't mess that up,
Yes, we
because
Thank you.
it could be easy to mess up.
Okay, the next item, 4.6, is our reopening update. I have several pieces to share with you. So let me pull this presentation up. We'll start with the reopening with metrics presentation. See if that'll come up for us. There it comes. Okay. So this is our update. As you know, we've been operating under Phase 3 in Virginia since schools reopened back on August 24th, with the understanding that the goal would always be to consider a phase-in to a 4-day model for all students eventually, as we better understand the health data and metrics and those types of things. So, reopening with metrics, we now have a pandemic dashboard that also includes indicators of risk for dynamic school decision making through the CDC. So VDH and CDC have now aligned and given us a dashboard that we can now better define metrics to better make these types of decisions with really more localized data. Before, there was some, but it was more regional and not so much by locality. And there's a lot of mitigating factors that can contribute to your reopening decisions as well. So how to read that dashboard is equally important. I just found out this morning on a special call with BDH in the state that they will also release another dashboard this week that is the Outbreak Dashboard. So that's going to report out localized outbreak information. That's interesting too, but just be wary that outbreak has a very loose definition with 2 cases in a localized area. So if you have 2 cases, you could be considered having an outbreak until further investigation proves that that's otherwise the case, and data could be suppressed or not depending on what they find out. So if you hear outbreak, it's a very extreme term for a situation that may not be extreme. So they really wanted to reiterate to superintendents and officials to understand when they release this dashboard this week, it may not, it may present data that could be alarming to some if they're not understanding how to read those and interpret those results. But none here, so we can say that. So basically, those indicators, the way that our COVID team and administration looked at those was to say, with the direction of VDH and our school liaison from VDH, was that you want your primary indicators in green or yellow status, your secondary indicators in green or yellow status, to consider a 4-day phased approach for opening. And they were very clear that with Rappahannock case counts and positivity rates and things that they would have no issue at all with Rappahannock returning for all in person if we decided to. That is a very localized decision. It's a local school board decision. It is not a VDH decision at all, but they were providing tools for local school boards to make those. That's why you see all these different districts making different choices, because it is by locality, okay? It's not a statewide mandate at all. But the state has been pushing over the last month or so, since Virginia data has been on a downward trend of positivity rates, to start to think about reopening, at least on a hybrid model as Rappahannock had done from the beginning. So that's why you're seeing other school districts now popping up with hybrid models and reopening plans and phased-in approaches and things. That's why. So that's the state conversation. So this is our continuum as outlined in our reopening plan, with scenario 3 being completely remote all the way to traditional. Our traditional for this school year has always been a 4-day. We never said that we were going to go to 5-day with all students right away. That just wasn't, it didn't seem like it was in the realm of possibility with everything that we have to do to mitigate and lower the transmission rates in the schools. We really felt like we needed, for the distance learning component, if we were going to offer that all year, as well as in-person options, that teachers would also need that planning and dedicated time on Wednesday for outreach for their remote learning students, as well as having that day in between to be able to properly sanitize everything in accordance with VDH guidelines. So that's why when I say traditional, I'm referring to 4-day. At no time this year were we considering going to 5-day unless poof, magic vaccine comes out and the virus is eradicated within a 6-week time frame, which you can imagine that's not going to happen. So, but we're hopeful that the vaccine will be released at some point over the winter is what we're hearing at this point. But it's the federal distribution of that, the last I've read from the sources they're giving to us, is prioritizing the healthcare workers, high-risk individuals in home healthcare facilities, and they want to push teachers and school facility workers and child care centers at the top of that list too as first responders. So that's a brand new development, which I'm very excited to see that. So we'll see how that progresses and what the distribution looks like and if all those things come to pass, and just a lot we don't know, especially with politics the way they are right now too. So phase 2 or phase 3, we're in phase 3 now, so that's why we're in the hybrid / scenario 1 traditional discussion. As we've pitched this the whole time, what we have said is we're going to do this very cautiously, very carefully, phased in, and really monitor health data, instructional data, and really get a lot of feedback from our stakeholders who are affected. So our measured phase-in transition would look something like this, beginning with our most vulnerable learners in K-2. That's where you're building your foundations, the structure is needed, literacy development is so crucial. Very, very, very difficult to do remotely, very difficult to do with 2 days. And we're seeing that now as we've accumulated 7 weeks of instructional data that we can see, and that we have identified where those gaps are, which is why we've taken this week as a workday week to really analyze and pinpoint that data and see how we can provide supports to bring that up. So starting there, we would like that our benchmarks are met for 2 consecutive indicator periods on the dashboard. What that means is an indicator period is a 2-week period, which 2 weeks is not enough time to really make decisions to pivot back and forth. So we would like 2 consecutive. So that's a whole month of showing where the trend is going, whether or not you can stabilize there and move on to the next phase, or just kind of steady, watch as it goes. And in some cases, if it did spike, it could regress back. But the idea is to phase in slowly so it stays at whatever level you're at for as long as possible. And once transition to 4-day, that's important for parents to know that once those grade bands transition, you're either remote or you're 4-day. There's no more hybrid 2-day. Okay. So this is sort of what this is the dashboard output that you can see by locality. This, for example, this is Rappahannock data. And I pulled this up on purpose to show you that VDH has advised any small counties with smaller populations to not use the case rate indicators and the change in cases. As you can see, the fluctuation can be quite drastic with our size. We're a small school district, so we understand probably better than anyone what the small n factor does to our subgroup populations in instructional data reporting. So what they would like us to focus on are the % positive school mitigation strategies that you implement. And also regionally, what the occupied hospital beds look like. And they said that can show you the encroaching amount of the rates of cases and how severe outbreaks can be. So they said to look at those, especially your own self-assessment of your mitigation procedures. And VDH has been very, very complimentary of everything that we were able to do. And I'll talk a little bit more about that in the budget section of this, but because we were able to put all those mitigation strategies in place, we've proved concept. We haven't had any more cases since that first week from a case that happened outside of here. So that's been very well contained. So options for beginning transition to 4-day. First semester, we could consider first semester starting on November 2nd to start to bring back K-2. And we put this out there as our survey to see what our stakeholders thought about that, and parents and staff. And I'll share those results with you in just a minute. So in that case, K-2 would begin November 2nd on a 4-day model. We would watch that for the rest of the semester and kind of keep track of those data points. So that means grade band 3 through 5 would not begin until after Christmas break, winter break, and come back January 5th. And then we'd watch that for the 2 indicator periods. The earliest 6 through 12 would come in would be February 1st on this phased approach, watching that data. Then the option is a second semester start, K-2. We plan for them to come back January 5th, begin with the 4-day, watch that 2 indicator periods. Your 3 through 5th grade wouldn't come in until February 1st, followed by 6 through 12. The earliest we could get those grades in would be March 1st. Again, prioritizing the phased-in approach to your most vulnerable populations. We also put out another option on the survey as well to say, well, we could plan for, depending on how things go, a January 5th start date to 4-day for everyone. So you're either remote or 4-day. So people could give us feedback on that as well. But the direction of VDH is not to overload everything right away. They say the phased approach this way would probably be most recommended. And again, VDH is a guiding agency. Even Department of Ed, in this case, is a guiding agency. The local school board have all the authority to determine how schools reopen and operate under these conditions. So our survey results are right here. So what's really interesting about this, if you can look at the yellow is to keep hybrid all year. That was the option for that. So both groups, which was really interesting because in a lot of this, as we've planned for pandemic response, we've had kind of divergent schools of thought on this between our parents and teachers. And in this case, they agree. I mean, so this is really neat. So maybe not about exactly when to start the 4-day transition, but certainly that we need to be thinking about that. And I think that's a really powerful statement from your teachers and staff, because I will tell you as instruction person, hybrid model is the most difficult model of teaching you could ever have to try to put together. These teachers are working like I've never seen before. And as a parent of 3 young children, I get my little notifications on my phone when their grades are updated and things, and constantly in consistency, I'm getting those at 11:30 at night, 12 o'clock, 12:05 at midnight, and consistently. So just a thought as we consider something else on the action items tonight. But for your teachers to say, no, you know what, we're comfortable, we've shown that this can work, we're working really hard, but we're going to sustain it because it's the safest thing to do for our school. So you saw the staff say that in these surveys. So parents, of course, would like us to begin, for the most part, 37% November 2nd. I can understand from my parent hat, I really get that. But the teachers, 38% is kind of reversed. Let's think about it, yes, but let's start January 5th after we kind of see how flu season goes and measure this throughout that section. The parent comments, super complimentary. These were great. Just how much they appreciate their teachers, their children's teachers, lots of outreach, very thankful for the schools reopening. I pulled out some contrasting comments. There were a lot, but just thinking, it felt like the theme was definitely a second semester start. Flu season came up quite a lot. There were some parents who said, no, just bring them all back, let's go. So there was that whole complete divergence there too. We approve of transitioning. I appreciate how difficult this is, but we have to exercise extreme caution, wait until a vaccine's there. So again, all over the map with some of these comments. Best interest of my child, she's connected to her instructor in a classroom environment. I know how hard teachers are working. RCPS is doing a great job. I'm glad we're now part of the Panther family. Teacher staff comments, pretty similar. A lot of those were thematized the same way. Wait till second semester, let's see how it goes. In person is definitely more effective instructionally, but we're just worried about, safety. Let's look at things in January, health and safety first. We've done well what we have in place right now. Don't want to rock the boat, which again, I'm just astonished at how hard these teachers are working and saying, go ahead, we'll finish it out. We got 3 more months. I'm like, oh gosh, I love you guys.
I have a daughter-in-law that's going crazy and as an English teacher, and it's all virtual.
All virtual.
Every class. She literally is going nuts.
Yeah, it's and just all virtual. So think about planning for Group A, Group B, virtual, in person 4 days. They're working so hard, but they're doing it with love and really supporting these children. This statement instructionally is pretty powerful and honest. My only students that are making the progress expected of them at this point are those attending 4 days, which we can probably expect from in-person instruction and that kind of engagement. And also the added issue of our broadband issue in the county, which is certainly rearing its ugly head with all of us. I have HughesNet, so I can tell you, when's your Zoom meeting? Everybody get off. Are you watching YouTube? Shut that off. So, I mean, that's what it's like at my house with 3 kids, so I can only understand. And I know going to hotspots can be difficult too. So we're dealing with that issue the best we can, but God bless our teachers and God bless our parents. They're all working so hard together to make this thing work and keep everyone safe. So we're just very blessed. I received this in a personal email after I sent out the survey, so I didn't put the person's name, but I did want to share it. When we believe we are loved, we move with passion. And she said, it's my goal for every one of my students to feel loved and supported in my classroom so that they may become more passionate about learning. Additionally, I feel loved and supported as a teacher at RCPS, which makes me even more passionate about what I do. I feel so blessed to be working in a place where I feel so valued. So thank you everyone for making our teachers feel that way, and you can feel that from them, as stressed as they've been, but still very appreciative. I put all the comments all together in a word cloud generator just to kind of see what words stood out. And I thought it was neat that in both cases, students and children were at the center of everything we said, which is a testament to this community. Flu season popped up quite a lot. A lot of people worried about that. But teachers needing time, students, again, children, teachers, that was all the themes of that. Do you have questions about anything I've presented on this part about what we're looking at? We will ask you to make a decision about when we can start to think about the phased approach during action items. That way everybody has a clear understanding of where we're going, with the understanding that should data not prove, then we will not move forward with that if those indicators and benchmarks are not met.
Whatever we're about to do, obviously you're going to need the flexibility to move forward and move backwards dynamically without us coming back to another board meeting.
Correct.
Regardless of what we do, we need to make sure that we build in that flexibility to move with the data in either direction, as we prescribe or we retreat, either way.
And of primary importance is the date of the beginning of the transition. So that's with moving back and forth. As soon as we have a start date where we begin the phase in, then I think the flexibility is in that, as we did in the reopening plan. So if we have that, that'll be the start. But yes, please build in that flexibility language as much as you can into whatever your motion is.
So the real difference is whether K2 is going to start in November or January.
Yes.
Because everything else cascades.
Yes, correct.
Any conversation about that, or anybody? I mean, we are going to be at a point where we're going to have to decide this tonight. So.
I'm leaning toward January 5th, just from the fact that you don't know what the flu is going to do, and it seemed, when I looked at it, it seemed that seemed to be a consensus of some kind. I know the parents want them to go back in November, but I'm not sure it's safe yet. But, who knows? Nobody knows.
I feel similar to you put it when I look at these two pie graphs. It looks like from our staff's perspective, it's almost 2/3 of the people who would be good with either continuing full hybrid or the January start. And that feels like I feel like it's important to really listen to the staff's consensus. It feels like this 9 weeks, from my perspective, has gone by really fast. And it hasn't, I don't feel like we're completely standing yet, in this setting. And I think there is a sort of adrenaline that comes with the first 9 weeks when you're doing a new thing and you're like, I've got it. And maybe just kind of getting it for real would feel more balanced for the teachers than knowing you're going to start after the semester.
So the only thing that's concerning me is, so Dr. Grimson made a comment at the very beginning, and that was about the K through 2, and that they're losing traction. They're not gaining what they need to gain, and it's a critical time. They can't, you don't have a do-over, right, for that critical time. It really is 6 weeks. Is it 6 weeks of education really different? So they've got the break. So they start November. It's about 6 weeks effectively, I think.
Yeah.
In there.
Yeah, and if I could add with that group too, from the teachers of the primary level, they agree that we need to get K-2 in as soon as possible to mitigate those gaps. However, they said with the inconsistency of, the flu season 1, that could affect things greatly. We wouldn't be able to prevent quarantines of larger groups with that many students in should we have exposures. But also the breaks in the calendar with the holidays and things, it would be kind of disjointed for those levels, which I hadn't, thought too much about. So we have other ideas for supporting and that's what we're doing this work week. Should that not happen November 2nd, we have ways that we can bring in more targeted interventions for those that need it and not put everyone into the same bucket too. So I do want you to know that we do have plans for that as well.
Getting that?
Yes.
Good.
Well, I agree. As soon as you get the kids back, the better for everybody, not just the K through 2, but everybody. Everybody's losing through this mess, but you don't want to jeopardize their health either.
Can you talk a little bit about the numbers of people? Because you're saying if we have K2 here, then we would be more, they'd all be in the same bucket. Can you expound on?
But okay, so what I meant on that is instructionally. Yeah. So they're not. You can't presume that everyone is in that same arena. But we do have some significant gaps, greater than we have seen before. Which I think is the case everywhere that we're seeing. That's just and more issues with our remote learners. And on the remote learning days where, engagement's really difficult. When you're teaching the foundations of literacy at that age, unless your parent is a trained reading teacher, and I am a first grader, I'll tell you, I'm a trained English teacher. I'm struggling with my child. So I can understand how, just working families trying to make this all come together and do what's right for their children. The same token, safety has to come first, and we've said that the entire time with this. When you're bringing in more numbers of smaller children who are, more likely to spread germs during this season, that can be problematic because if there is an exposure, it's going to be more difficult to contain that. We can contain it in grade level, in cohorts and classes, like what our plan suggests, but it would probably likely turn into a quarantine of a classroom pretty quickly. So, there's that chance of a disjointed.
How would you maintain your class size if you brought everybody back before?
Well, and that's the other thing. We did put that as a key consideration on the surveys that should we bring all groups back, we can't social distance 6 feet in most cases for some of those numbers. So we wouldn't be able to maintain that, which doesn't mean that we're not really reducing transmission of the risk of transmission of the virus with our barriers, masks, and then coming up, and I'll talk about more in the budget update, the HVAC upgrade we're about to do as well. So the risk of transmission is going to be much lower. However, you can be an impenetrable bubble from NASA and B, 6 feet for someone for 15 minutes, a BDH will quarantine you.
Right.
So it doesn't really matter for quarantine. It matters for lowering the risk of transmission, which is our ultimate goal.
That's
because
the
we don't want
ultimate
anyone
goal.
sick.
That's the whole thing.
But we're just not going to prevent absences, but that's 2-week quarantine. So that's a lot of disjointedness. So those are considerations, and we can't prevent that. So if our goal is to maintain as much continuity in instruction as possible for the most students as possible for as long as possible, then the hybrid model, especially when, flu season and colds and strep and everything hits an all-time high, would probably be the one most likely to contain and keep continuity going.
I would be, the unknowns are the weather, the flu.
Tourist season. We have,
It's flu season coming.
Yeah.
One real quick question before we go on. In your parent survey, the 16% of transition for second graders, was that all parents or just parents of K to 2?
That's all parents.
All parents. Well, K to 2 might be a higher number, percentage-wise, maybe.
Yeah.
I would be inclined to think, we have 2 meetings prior to January. I'd be inclined to think that if we shot for January 5, and if things look really good in December, we can make that move.
Earlier, right?
So January 5 for K2. And then if things don't go well, we don't have to do that.
And then you got Christmas break in between.
Oh, yeah.
Which regardless, we will
Might be
revisit this, each time I do plan to give you the pandemic dashboard update. So you'll see the data too, and we can make changes, at those meetings. But for tonight, it'd be helpful just to have a date we plan to start, say it's January 5th. However, as we approach that date, we'll look at data at the November meeting and at the December meeting, and we may have to change it.
Yeah. I think the November start is, in my way of thinking, is a no-go. There's just no way to do it. January is something to look at, and that gives you, most of October and November and December to get a handle on where the virus is, and where we are as a county, and what these numbers look like. I mean, they could skyrocket. Who knows?
Yeah, and that's the hard part. I wish I had a crystal ball.
Yeah.
And I could tell you, there's just so many unknowns, and,
So we'll call that, what are we going to call that thing? The second semester plan? Give it a name, we'll give it a name.
Yeah,
right?
that's a good name.
January plan.
Okay.
That would phase in, starting with K2.
Hey, it's something to shoot for.
Good target. I'd be so proud.
I mean, we're so far ahead of the counties around us, it's just unbelievable. Especially the ones to the north. They're in deep trouble.
Oh, my goodness.
Deep, deep trouble.
I don't want to even imagine. I'm just very thankful to be in Rappahannock. I love this place. So that's all I will say about that. All my colleagues are working very hard.
I get an update about every 3 days, so I can tell you we're in trouble.
So if we're okay with that section, I'll move on to a quick budget update, because as you can imagine, budget has been a whirlwind since we closed out FY20 with the CARES Act, and then the county received some CARES Act funding as well. We got our new sales tax projections, and that looked like that was going to be a huge revenue loss for us in the amount of $153,000. ADM across the state. Your average daily membership is very unstable. Many districts losing their enrollment, and ADM is down. So there's a very large projected shortfall among districts, I think in the vicinity of $15 million across the state.
It was more than that. Did you see it today? It was 27,000 kids that have not enrolled.
Yeah.
And it was tons and tons of money.
It is. When you rely really heavily on ADM funds, luckily in Rappahannock, LCI is positive for once. So in this case, fluctuations of that nature aren't affecting us as heavily. However, our ADM, this is probably one of the first times I'm going to ever say that, our ADM is stable. So we've seen a rapid decline by 6% over the last 5 years or so in our enrollment. So this year it's stabilized. And from the State Department's updates, they have told us that, that seems to be the trend of schools that have reopened for some in person, that their ADMs are pretty stable, if not gone up, from surrounding counties in virtual situations sending kids there. So that's what we've seen in those fluctuations. So now, given all of that, the General Assembly is in special session right now discussing a whole lot of items. So between the Senate Finance Committee and the House Appropriation Committee, we're watching those bills very, very carefully. And when I look at those, I always look for the alignment in them, because that means if they both agree, then that's going to have a great chance of going through. So what we see in both is that the sales tax revenue will be the loss. They will issue hold harmless payments to school divisions for this year. Now, that's not as to say that that won't affect us in FY22. But it says that very clearly that they're not going to basically punish school districts, especially operating in the times that are so much more costly for the state sales tax. County administrators across the state and superintendents are a little bit baffled by the sales tax revenue projections, so we're asking for some kind of remuneration there because the sales tax revenue in localities looks actually very healthy. So we're just really watching that with a very critical eye. Teacher compensation has been a part of the discussion quite a bit. Right now, the Senate Finance Committee wants to put forth a 2% bonus in FY22 for teachers.
Is that all teachers, or is that just
teachers?
SOL teachers?
SOQ teachers?
SOQ?
Well, SOQ, remember, is just about everybody. You can't take out all staff from that because of the SOQ funding formula. This one looks as if it would be teachers, instructional staff only. So, but again, it's still in committee, so I haven't seen after the appropriation language and the distribution and how that's going to be interpreted yet. But, remember our goal was to work toward a 5% increase over 2 years, with this year, FY21, being a step plus a 3% for all SOQ eligible positions. We weren't able to do that because there were so many unknowns. So we were able to do a step, which was a lot more than a lot of counties were able to do, watching for revenue shortfalls in the state sales tax. Additionally, here we have the contingency fund being held by the county. We have $185,000 that was appropriated for our budget, but being held depending on how revenues look. If that $185,000 had been released, then that would have funded our entire compensation plan for the school board FY21 budget. I still have yet to understand what they will do with that, but I'm at every meeting, so they have been very, very generous to us, so I'm not really pushing too much, and they really have their eyes set on broadband expansion. So I'm a little like, okay. So that's a good thing, but that's a common goal, I think, for everyone. Broadband expansion is pretty high, #1 on our list, especially with the distance learning stuff we have going on. Coronavirus Relief Fund, CRF, in the General Assembly pushed out, and this was signed already by the governor to get quick relief to school divisions. So they pushed out another $200 million to school districts. Of that, we are receiving $128,000 in direct coronavirus relief. So we found that out, which was so exciting because that will fund our HVAC upgrades that we really wanted to do, that we held. We had our bids ready. And what that includes is an entire upgrade to our ionization, decontamination, UV light ionizers, and decontamination systems in all our circulatory systems. So all our classrooms, our porticos, even hallways, everything.
120 is good.
That's cool. Yes, it actually fell just under that for the winning bid. So yeah, we'll get that started. Very term limited funds. They have to be encumbered and spent out by November 30th. But we are assured by the winning bidder that that can be done. So we're thrilled about that. School nutrition feeding programs, Mandy gave that update during the Commit to Be Fit update. So it looks as though the USDA waiver extension for free breakfast and free lunch for all students will extend through the entire school year, which is fantastic. The county cares. I have to put this out there because the county has really redirected a lot of their allocated funds. They received the $634,000 payment, I guess back in April, May, to close out FY20. Allocated quite a bit for us, and again in FY21. So things like our devices and extra PPE, desk barriers, the touchless dryers, sanitization stations. They funded the the Wonderful Wednesday program we've been seeing such wonderful things about, and our auditorium upgrade, which is going on as we speak. So providing that additional lecture seating and revamping the auditorium will allow us to bring in bigger groups of students and maintaining our social distancing guidelines too. Total CARES funding coming from the county, $537,264. So we're very thankful, and that's a huge reason why we were able to reopen the way that we did as early as we did. We knew we had that funding available, so we were able to push the button on all our orders and get them in by the end of April. And they still didn't come in until a week before school started for the most part. So
Better than the ones that haven't come in yet.
Still,
School systems.
a lot of school systems are waiting till November and December, and they've ordered in June. So, I mean, that's how the supply and demand has been affected. So we're very fortunate that way. Local impact for our current FY21 considerations preserves local CARES funding to that we can spend through September 2022. So we still have not had to reimburse through that fund yet. We're holding that as long as possible for we have plans for it, mainly compensation for our extra sanitization, extra hours, the feeding program, basically hazard and overtime pay for the extra duties that were not funded in the budget. So that's what we're sort of placeholding, but that does roll over. So we have some time on that money. So if at all possible, we try to preserve that. The CRF infusion, again, will pay for our HVAC upgrade. And because now the sales tax revenue shortfall does not exist, and we're in good standing as far as ADM and we're stable, the budget actually looks really good to continue toward the goal of our compensation package. Now, I don't know what, again, the county will do with the contingency funds. However, our teachers, like I was saying before, have worked like they've never worked before. And this model is the most difficult to manage and try to function, and I think they're doing an outstanding job. We've identified a lot of challenges that we're working through this week, but for the most part, I could not be more proud of this staff. So, in particular, the teachers. At this point, the teachers are probably, they're working harder than anybody I've ever seen. So I would like to recommend that the board vote on a 2% teacher recognition raise effective December 2020. And that is per our goal initially. Now, we don't have enough leeway right now to be able to do that as our projected SOQ. Should the contingency funds be released, we could consider that. But at this point in time, I think it would be a huge morale booster, a great way to keep your teachers going, and telling them how much you really appreciate all the work that they're doing, because they deserve it.
That would be a recognition raise if funds are available?
No, we have this available
We have
now.
that available.
Yes. That we would feel safe doing right now. Now, it's not an SOQ, so it wouldn't, cover everyone, but this is for your instructional teachers who are managing this hybrid model right now.
How about other employees?
Right now, no, but we have plans for some of those funds to take care of things in other ways, and we also received a grant from the community that, I think I mentioned that at the last board meeting, of $100,000 to help go toward supporting your staff. So we have a lot of surprises and ways to take care of staff in other ways. But this way would be direct compensation toward the goal of what we had initially had. So, and maybe we can manage all of it eventually, but we said by December we would try to make a decision on that.
So we'll vote tonight about the teacher recognition raise, and that doesn't get us to where we had originally planned, which was 3% for everybody.
Right.
Right, step plus 3. So at some point we'll revisit the gap, right?
Yes, and as we look at the FY22 budget planning process, we should really try to take care of some of those pay scales that are up for review cycle. We'll look at the differentials. We'll definitely benchmark to the median across the region. We're uniquely poised right now because a lot of these school divisions that we're usually competing with are not able to do these increases right now. So that'll finally give us a little bit of a competitive edge if we do that now when we're able, because we're not always in that position. Usually we're just playing catch up. So,
Of course, the only other thing I'm thinking there, just out of fairness, is that if we say we're starting something December, it's not retroactive. So we originally, our intent was to finance the raise for the year, and basically 4 months of that year have passed them by. And what we're planning right now with the motion tonight is not retroactive. It's just starting December 2020, great job. And but when we go to revisit the gap, we should also consider this gap from
correct.
August, is it August 1st? Right?
It would start, well, yes. Yeah.
August 1st through December, through December 1st.
Well, if the contingency funds were released, for instance, let's just talk hypothetically. So if that were to happen and we looked at the working toward that goal, and honestly, with the expenses we've had and things still yet to come, it may not be there for the entire thing. So you'd have to determine at this point in time we feel comfortable bringing everyone up to the 2%. And we did do the step. But yes, I would recommend that be retroactive, since that entire budgeted amount was for the entire year, to build that in. And we could possibly do that with this.
You would start your budget process with the additional number already in it.
Right.
So that would be a 2% raise. And then your new budget process, 22, 23, there?
Yes.
Would start with that money in the pot.
It would for teachers. Those teacher scales were a target for us, up for review now. That's why the teacher scales are the ones being reviewed. Now, as we go through the budget process, and let's say, I think support staff scales are up next too, for your aides and your, so they're up next. Now, as we do those changes and benchmarking to the median, they could see a pretty significant increase. Everyone on that scale gets adjusted. Could be a 6%, so as we review scale by scale, the teacher scale is the most difficult to move because the most people are on that scale. So when you have a chance to do that, that's, probably a good thing to do.
I just want to keep us mindful that when we revisit it, we're revisiting gaps from our original goal, that we don't forget this one.
No, definitely not.
Too.
Thank you so much for that consideration, and thank you to Rappahannock County. I mean, that's everyone working so hard together and lifting each other up and being supportive, I think, is keeping everything going. And yes, at times I feel like we're all just kind of hanging by a thin thread, all of us, parents and teachers and administrators, at any given time. But what I'm seeing is, the parents reaching out to each other on social media and, working really hard to even commiserate, but support and offer strategies and what are you doing, and working with the teachers. So the supervisors giving us the funding we needed, the community groups that have banded together to offer these, the Wednesday program, and, RKC and Headwaters now doing after school enrichment, and just all those things that are so important. Who thought that we could accomplish everything we have in our crisis situation, so Rappahannock strong. We are very grateful. Any questions?
Great news about the HVAC. I love that. I'm so happy to hear that.
That's going to be great for all, even after this thing, as far as any particles and dust and mold and any issue we have in HVAC. It's going to really help take care of that. So we will have the cleanest air in any school.
No, it's wonderful. No, seriously.
Yeah, you'll be breathing better. Just don't come in when we're doing the sanitization chemicals after hours. Well, thank you. That concludes my reports, unless you have any
Is there
questions.
any other questions? Very thorough. Thank you very much.
You're welcome.
Very good plan. All right, moving on to reports of the board. Headwaters represent.
I have a report. There's several items. The first is that Headwaters did get awarded a PATH Community Resilience Grant that will help with their operating costs during these uncertain times. It's notable that we missed having the Taste of Rappahannock in September, and still concerning how they're looking at creative ways of making up for that usually enormous fundraiser that's been annual. The after-school program is open for registration, and it'll be for elementary school students. It'll be enrichment opportunities, scheduled homework support, snacks, and it starts on October 20th. It needs to have 15 students at least enrolled for each Tuesday and Thursday cohort to make the program viable, so make sure people know about it. It's separate from the Wonderful Wednesday camp. It's an after-school program, so it's amazing how many opportunities we have for kids and to support families. And it's a high-quality program. I know my kids have been in it. Headwaters has finished their search for a new starfish director, and they've offered the position, so look forward to hearing once the contract is signed who that person is. They're very excited about having found someone. And Starfish is going to be revamping a little bit in terms that there still will be the long-term mentorships, but also a more contained amount of time that mentors can get started on. So that's a great, it's a great program, and it's a very supportive program. And then the last news is that Headwaters is jumping on to support the Ag Academy with Mrs. Fincham and Dr. Grimsley, applying for the Gordon Thornhill Excellence in Youth Grant from the Northern Piedmont Community Foundation. And it would help to support the Ag Academy and help, and Headwaters will be a booster of the Academy going forward. So a lot going on. Very active. Thank you, Headwaters, for all this work.
Thank you. MVGS?
We did not meet, but as most people know, Roseanne is retired, so we're looking for a new director. The board has done a card for her and a little token of our appreciation. And we'll see where that goes.
And so, was it 2006? What year was?
I think it was 5 or 6. I can't remember.
I should remember that. So she's been a excellent director, excellent resource for that group, and
we have to remember that we have, since I've been on the board, we've increased our numbers by threefold of youngsters that are taking part in that program, and it's a
great program.
And
it's exceptional.
Roseanne's been there since the kickoff. So
she was
everything
there.
that it's become, you know, she was the CEO that brought
I think she's there 16 years, 15, 16 years, yeah. Something like that. But she's going to go play with her new granddaughter.
Oh, well, good for her.
I guess we'll let her.
Great. Moving on to public comment, or somebody like to address the board this evening, if you would rise and come to the mic and speak loudly. Anyone?
Yeah.
You want to go to that one? I guess you can come to this one. Do you want to come to this
work.
one?
I think you can come to that one.
We'll hear you better on that.
Yeah, you can get a chair and use this one if you want.
I just have two questions. The first is with opening up in January, if that's what you guys decide, or in November for the 2K and stuff. Do we already have enough protective shields to add on to the other desks that are going to need them? Or is that something that has to be ordered? And like you said, lots of people are already waiting on their supplies. Are we going to be behind in being able to open because we don't have those? The next question is, if we are pushed back, especially at the high school level, till March possibly, or even further, for 4 days, how does that affect sports? I know we were supposed to start sports sometime, I think in December it was, and how is that affecting the kids who don't have buses here, or only here 2 days, or here virtual, to be able to play those sports or to be behind their peers in getting practice time?
Can you state your name?
Oh, Beth Gaynor.
Yeah, thank you, Beth.
Larry's.
That's good enough, Beth. You got it.
It's a new name for a district, right?
Yeah, Larry's.
Larry's down. Thank you.
That sports transition, by the way, that's going to be true for every school district. It's going to be harder in other districts than it will be here. However, they're going to pull it off, you know. No. And as far as supplies go, you know, we certainly won't move forward without appropriate precautions.
Is it okay to exchange during, okay. So we have been inventorying all of that so far. So in some cases, yes, we have plenty. In some, not quite yet, but the orders have been placed, which is nice too, to have this additional time to make sure we get everything in, because in any classroom, we've already spoken to staff about this, if you don't have those barriers in place, we are going to require the mask in the classroom. Just so we have some type of physical barrier between droplets. So that would be the mandate. If we don't have them in any case, then they would definitely have that, especially if we're moving within the 6-foot social distance. And the sports question is a great one. Anyone on remote and virtual is eligible. It's just going to be transportation, logistics, and how that's going to work. And VHSL, I know, still has quite a few things to figure out on how that season is going to look anyway, especially with the overlaps and the multiple kids playing different sports. So
we have no idea what the state's actually going to do.
It's going to be interesting. So as we get closer, we'll have our AD, Nurse Atkins, come and make sure to update us on what the latest is, because it is changing quite a bit. So we'll keep you updated.
They were even meeting this week
Yes.
to discuss that. And,
right. Good questions, though. Thank you.
And they were concerned about how to pull off a practice.
Let alone the game.
Our AD was able to help them with that topic. So, yeah. All right. Anyone else this evening? You want to come join us at the table? Anybody? Oh. All right. Moving on. We have a motion concerning the termination of our regional special education program. Ms. Meyer, can you read that?
You want me to read it?
Do you mind just reading it? Because we're going to give a copy to, we need to read it in its current format.
All right. Rappahannock County School Board moves to terminate the Fauquier Rappahannock Warren Regional Special Education Program effective immediately and pursuant to Section 12 of the agreement to establish and operate the Fauquier Rappahannock Warren Regional Special Education Program entered into by Rappahannock County School Board on February 10th, 2020.
Thank you very much. Ms. Meyer made the motion. Is there a second? I have a second for Mr. Grove. Any discussion? Thanks for explaining that to us, Dr. Johnson. All in favor, aye?
Aye.
Aye. Opposed, no. And so ordered. Regarding the reopening plan, so I was trying to write down how this is going to speak. Here's my best shot at it. The motion would be to start a 4-day plan at the second semester in January. And then I put here with flexibility to adjust the schedule based on metrics, on established metrics of the plan.
I
Okay?
think that's good, yeah.
Yeah?
Because if we get the kids in before Christmas, then the others can start coming.
Should we include the word phase, like to start a phase?
Phased? So that's in the plan.
Phased approach, right.
As
I
outlined.
think you have to rely on the CDC and the state and what phase we're in and yada yada.
All right, so here's the motion. I'm going to read it. Are you ready? Here we go.
Go for it.
Where did I start? Second semester phased start with flexibility to adjust schedule based on established metrics of the plan. Right? That's going to be our motion.
We'll watch the video.
Yeah, we'll watch the video. So if I can't read it, Amy, there's no way you can read it. So that'll be our motion. Is there a second?
Second.
We have a second from Ms. Meyer.
I got a question.
I have a question.
The reopening plan would be to begin with a phased-in K2, and then 3-5 or 3, whatever the number
Right, just as presented.
as it was on the board. Okay.
That's what Ms.
As
Bynum
presented with those stairs.
It's the advertised phased-in
Oh, we
process.
added the word phased?
I don't want people to think
Not everyone all at
that
once.
January 5, everybody comes back.
Yeah, no.
Right, that's why I wanted to put that in, because I don't I don't want it to.
Does that make sense?
Possibly a flood.
Yes, that makes sense. I think we all agree that's what we mean by the word phased.
Okay.
We should document.
Yes, thank you.
Second.
We have a second. We have a motion. I made the motion. Ms. Meyer had the second. We had discussion. Is there any other discussion? All in favor, aye?
Aye.
Aye. Opposed, no. And so ordered. Now, is there a motion concerning the approval of a 2% teacher recognition raise effective December 2020?
So moved.
Motion, Mr. Grove. Is there a second?
Second.
Second from Ms. Bynum. Any discussion?
No.
Yay, teachers.
Yes. Yeah, I agree. I'm glad I'm retired. I don't know what to do.
That's right. And it's what we are able to do. It's what we're going to do.
Thank you, because we'll never, ever be able to pay teachers what they're worth.
Oh.
So thank you for paying them what they've earned. I appreciate that.
Right, all in favor, aye?
Aye.
Aye. Opposed, no. And so ordered. Is there any new business this evening? I had one thing.
Oh.
4 years ago, we had a very emotional election period, and we had some issues. And so I've decided what I want to do is I want to read this tonight just to make sure that we all understand the policy according to the school board policy related to politics and the role politics has in school, or the role it doesn't have in school. So I'm just going to read it. It won't take me but 2 minutes at the most. The Rappahannock County School Board recognizes the right of its employees to engage in political activity. The board also recognizes that school time and school property should not be used for partisan political purposes. Thus, in his or her political activities, an employee may not use his or her position within the school division to further a political cause, engage in any activity supporting or opposing a candidate or a political party while on duty, while on school property during school hours, or while representing the school division. Suggest any manner that the school division or any component of it supports or opposes a candidate for election to any office, or use any school division property to engage in any activity supporting or opposing a candidate for public office or public party. These restrictions are not intended to limit the rights of school division employees to support or oppose any political candidate or party on their time. They are intended to minimize distractions from instructions to assure that no public funds are used to support any candidate for public office, and to assure that the public is not given the false impression that the school division supports or opposes any political candidate or party. School division employees who engage in political activities on their own time must make it clear that their views and actions represent their individual positions and do not represent the views of the school division. This is a common policy throughout the state of Virginia. And it's important for us to be reminded of it for the sake of our children and this environment that we protect. Is there any other new business? Our next regularly scheduled board meeting is November the 10th, which I think is the day before Veterans Day, right? Back in the same location at 6:30 p.m. At this time, we're going to be moving into closed session, and we're going to be in there, how long, Dr. Grimsley?
25 minutes.
25, 30 minutes. So if you want to hang out, we'll be back, and we will then certify and do motions related to closed session if necessary. And is there a motion to go into closed session?
I move the board convene into closed session for following purpose: to discuss and consider the appointment of staff for classified positions, dismissal of a classified position, personnel number 2020-21-01, recognition of a classified position, and discussion of superintendent's goals pursuant to Virginia Code 2.2-3711A1.
Thank you, Mr. Grove. We have a motion. Is there a second?
Second.
Second from Ms. Meyer. All in favor, aye? Aye. Aye. Opposed, no. This order. So we're going to recess into another room. And if you can't hang around, thanks for coming.